Hello and welcome to Headline News in Neuroendocrine Tumors, or NETs. I'm Steve Highsmith. This series of videos will focus on several important abstracts presented at the 8th Annual European Neuroendocrine Society meeting held March 9th to 11th in Lisbon, Portugal. Throughout 2011, Oncology.TV will bring you in-depth coverage of the latest data and abstracts presented at major Neuroendocrine Tumor Society meetings. In this segment, we're hearing from Dr. Jonathan Strosberg, who discussed the intriguing results of his study on survival analyses in pNETs. Dr. Strosberg, thanks for joining us. Can you tell our audience about the staging classifications for pancreatic NETs?
Well, until several years ago, there were actually no staging classifications for pancreatic neuroendocrine tumors. We spoke in terms of localized, locally advanced, and metastatic. In 2008, I believe, the European Neuroendocrine Tumor Society, ENETS, developed its own T&M staging classification for pancreatic NETs, and last year the American Joint Commission on Cancer, AJCC, developed a separate staging classification. It goes from stage 1, localized, to stage 4, metastatic.
What was the aim of the study that you conducted?
Well, the goal was to look at the two staging classifications, AJCC and ENETS, in a large sample of pancreatic NETs that we see at Moffitt Cancer Center over a period of about 10 years, and basically test the prognostic accuracy of both staging classifications in terms of overall survival and also in terms of recurrence-free survival after surgical resection of non-metastatic tumors.
And what can you tell us about the results of the study?
We found that both staging classifications actually were quite prognostic in terms of overall survival for the entire group of patients with a high level of statistical significance. The survival durations range from 57% in distant metastases at 5 years to nearly 100% for patients with stage 1 tumors using both staging systems. As far as recurrence-free survival, we also found that both staging classifications were fairly predictive for recurrence after surgical resection.
Intriguing. Can you comment further on the conclusions?
Either staging classification can be used. We really need to develop collaborations so we can look at much larger samples of patients and really figure out whether one system is superior to another or not. But we also learned a lot of other things from this analysis. We learned, for example, that one of the most important factors in determining prognosis is not only stage but tumor grade. In other words, how aggressive the tumors look under the microscope. We also found that for non-metastatic cases, whether patients had tumors that were detected incidentally or whether they were symptomatic at diagnosis made a big difference as far as their outcomes and risk of recurrence. And we also found that the survival durations in our analysis were vastly superior to what we see from population databases like the National SEER database and the National Cancer database in the United States, where 5-year survival rates for metastatic disease are only about 15% to 19% versus 57% in our database. So we're trying to figure out what explains these discrepancies between our institutional cohort and a national population cohort.
Dr. Strosberg, if you will, talk about the risk of metastasis after resection and why you chose to do this study.
Well, there's really very little data on the risk of recurrence after resection of pancreatic NETs. And particularly no data looking at that risk of recurrence stratified by either of the new staging systems, either the AJCC or ENETS staging system. So unfortunately, when patients undergo resection of a pancreatic NET, it's very hard to give them accurate information on what the risk of recurrence is, and if they do recur, when do those recurrences take place? So that's what we set out to investigate.
Based on the results you have so far, what are your next steps?
Well, one thing we're trying to figure out is the reasons behind the discrepancies between our own population cohort and others that have been done in Europe versus these national population databases. Why are the results so different? I mean, we're talking about differences by a factor of 4. So that's a very, very large discrepancy. Other things we need to do is develop multi-institutional collaborations to develop even larger databases. I mean, 400 pancreatic NETs is a fairly large database, but we can do better if we collaborate with other institutions. So We're working currently with NCCN, the National Comprehensive Cancer Network, to develop a database that includes 7 or 8 large cancer centers in the United States, not just of pancreatic NETs, but of all neuroendocrine tumors. So that's going to be probably the largest database. I know the Europeans are doing their own, and I think we'll see some interesting results from that.
What are some of the key findings at the ENETS meeting that you think are of interest?
There's actually been a lot of progress in the past year in terms of treating neuroendocrine tumors, and especially pancreatic neuroendocrine tumors. Both everolimus and sunitinib have been tested in large phase 3 studies, both found to significantly improve progression-free survival. This is not the first meeting where this data has been presented, but it's certainly relatively new and obviously very exciting. The fact that we're seeing new drugs being developed for relatively rare diseases.
Dr. Strosberg, thank you for your insights, sir. That's Jonathan Strosberg discussing the intriguing results of his study on survival analyses in pNETs. We thank all of the experts who participated in this edition of Headline News in NETs. I'm Steve Highsmith. Be sure to watch coverage on the latest news in NETs right here on Oncology.TV.